Hi, how do I slim somebody's face with my aesthetic treatments, and what are the areas I have to be really cautious about? When I'm looking at somebody in the clinic, I'm looking at their skin quality and how fresh and elastic and bouncy it is. And over time, it gets more lax and loose and crepey. Sometimes it's a question of trying to improve the quality of the skin with treatments, particularly biostimulators or collagen stimulators. If muscles are contributing to excessive facial width, for example, the masseters here that we use to clench and that we use to chew our food, that can overgrow, particularly in younger people, and we get a widening of the face that can look a bit masculine in women. We call that masseter hypertrophy, and there's an aesthetic or cosmetic element, which is the appearance of it, and there may be a medical element where you could have teeth grinding, bruxism, you could have pain in the joints. We call that TMJ dysfunction. In younger women, particularly, I will often use botulinum toxin, which is a prescription-only medicine, to shrink that muscle, and it can take up to 4 weeks to be fully effective because the muscle is fairly substantial bulk. I'm really cautious in more mature women where that muscle growth is actually giving some structural support to the face, and I'm concerned in older women that if I shrink those muscles that I might contribute to jowling or worsening of jowling. So I'm cautious in older women. If somebody comes in and their bone structure is good, the muscle activity is normal, I can get some slimming of the face by actually starting higher up in the mid-face here and getting a little bit of lift again around the sides with collagen stimulators or with hyaluronic acid dermal fillers. I might use treatments to improve the skin quality, and one of my favorites is skin pen microneedling. That really helps. Or I may do some laser resurfacing to help the skin quality as well. If there's a fair amount of jowling, you can actually disguise it by using dermal fillers, which sounds counterintuitive. You think you're going to add bulk, but by carefully placing it along the jawline and along this gap here we call the prejowl sulcus, you can actually give a much more defined outline. It's first of all doing the diagnostics, doing that detective work as to what's contributing to it. I'll often use my ultrasound machine to look at the bulk of the masseter muscles, to look at the parotid gland, which is overlying it, which produces saliva, and I'll look at the bone structure, and then I'll make my diagnosis and make my treatment plan for there. Do get in touch if you have any questions, and I'll put all our booking links below if you'd like to come in and see me for a personalised consultation. Take care, bye.